part of the celebration of the International Day of the Aged, which takes place on October 1st. In this World Report, we have data and recommendations which are very relevant for the new epidemiological and democratic context that will affect the world's population in coming decades regarding the growing aging of the population.
We are pleased that for this launching, we have a panel of distinguished experts on international public health who will inform us about the relevance of the World Report on Aging and Health. We have with us on this panel Dr. Margaret Chan, Director General of the World Health Organization, Dr. Carissa Etienne, who is the Director of the Pan American Health Organization, Ms. Kathy Greenland, who is the Secretary on Aging and Life in the Community within the Department of Health and Social Services of the United States, and Dr. John Beard, Director of the Department of Aging and the Life Course at the World Health Organization. We invite Dr. Margaret Chan, Director General of the WHO, to please take the floor and speak to us about the importance of this World Report on Aging and Health. Dr. Chan, you have the floor.
Thank you very much. Good morning to all of you, distinguished members of the community, PAHO member states delegations, and of course, members of the panel, and friends and colleagues in public health. I'm delighted to be here today to launch the first ever World Report on Aging and Health. This is a time of unpredictable challenges for health. Whether these challenges are coming from a changing climate, emerging infectious diseases, or the next microbe that develops drug resistance. Yet one global trend is very certain. Populations are aging, and at a very fast pace. Today, for the first time in history, most people can expect to live into their 60s and beyond. Just look around. I'm one of them. The consequences for health systems, their workforce, and budgets are profound. The World Report on Aging and Health brings together the latest evidence on the health of older people. It summarizes both the opportunities that accompany population aging and the many barriers and knowledge gaps that block these opportunities. Some of these barriers arise because of a mismatch between the needs of older people and the services offered by health systems. Most health systems were set up to manage acute conditions, and the biggest challenges for older people come from chronic diseases, and they may have more than one such condition. It's not uncommon to see elderly people to have both hypertension, diabetes, some kind of respiratory problems. So we call it comorbidity. So it is important that going forward, how do health systems in the world structure in such a way to take care of these conditions of the aging people? Now, the long-term care is another important area that is frequently left to families with very little support and guidance, either from governments or from international organizations. As populations age and the proportion of older people grows, such arrangements become unsustainable. In many countries, long-term care stops someone from going to school or from going to work because they have to stay home to take care of the older persons. The limits of what families can do is another problem. Older people often fill hospital beds, not because they need acute care, but because there's nowhere else to go. One statistic underscores the burden of unsupported family care. Around 10% of older people are victims of elder abuse. Some of the most pervasive barriers to maintaining the health and independence of older people come from common perceptions and assumptions about older people that are based on outdated stereotypes. In one of its most important achievements, this World Report counters these misconceptions and misperceptions with the facts. The loss of ability typically associated with aging is only loosely related to a person's chronological age. There is no typical older persons. Look at me. I don't want to use others as an example. Look at me, I'm 68 years old. I look younger and I move faster. And I have more energy than most young people. And many young people in WHO office, you know, when I travel around the world to your countries, to countries in other regions, I have young people follow me. They have to wear roller skates in order to catch up with me. And I'm always wearing high heels. So, chronological age means nothing. It is a state of mind. It is the functional abilities. That's very important. Now, this disconnect, meaning you may be chronologically senior, but your bodily function is still young. This resulting diversity in the capacities and health needs of older people is not random. It is rooted in the events throughout the life course that can often be modified. Again, using me as an example because I don't want to upset people. I sing and dance all my life. So keep up, those are very good physical activities, right? Carissa? Yes. So I encourage, you know, activities, a positive state of mind, you know, keep your functions up. So age is just a number. So though many, on the other hand though, many older persons will eventually experience multiple health problems. And older age does not imply dependence. They may need a bit of help so that they can maintain their functional abilities to age with dignity, grace, and healthy. So let me once again thank you for all that you have done. And there is much more work that we need to work together to provide an enabling environment for older persons to thrive and enjoy doing the kind of things that they don't do when they are working. You know, after retirement, there is new life, even better life. Yesterday, Mr. Roses told me life is better after retirement. So we need to think in that positive light. So once again, it's all in our hands to be able to support older persons to live a dignified and decent life. Thank you.
Thank you, Doctora Chen. Muchas gracias, doctora.
Thank you very much, Dr. Chang. Now we invite Dr. John Beard, Director of the Department of Aging and Life Course of the World Health Organization, to speak to us about the technical aspects of the World Report. John, you have the floor.
Director General, distinguished guests, and I can assure you as one of her staff that the Director General does move very fast. And what I tell her is that that's actually probably the best marker of a healthy outcome. It's much better predictor of good health in the future than the presence or absence of disease. And so I think you should all try and catch up with her. I'm waiting for a presentation. So the world is indeed rapidly aging. This is a map of the world today, and it looks at the proportion of the population that's aged over 60 years. And you'll see that only one country on the planet is currently in the dark blue, representing over 30% of the population of that age. If we look forward, though, over the next 35 years, you'll see that this becomes a very different world. And so this is a transition that's affecting many, many places that people don't necessarily expect, particularly in low and middle income countries. For example, places like Iran, Thailand, and here in this region, one of many countries which actually will be quite aged towards the middle of the century, Chile. This is quite convincing when you want policymakers to pay attention to the topic, but unfortunately this is not a good place to start when you look at developing public health action. And I'll use the example of Japan to try to explain why. Because what this map does is it says there's some time, for this map it's 60 years, when you go to bed and at midnight you wake up and you're old. And in fact, that's not the way the world operates, but this is the way this is where this thinking leads. So this map shows at the bottom, so this is starting in 1950, and you can see in 1950 there were just a very few older people in Japan. Above that arbitrary line there were a large number of people in traditional working ages, and also a large number of children. As we move forward over the next century, you'll see how dramatically that population structure changes. Now, when you see this figure, you can understand why economists say, oh my God, it's a tsunami of older people. How are we going to be able to afford this? But this figure is fundamentally flawed. For example, if you look at the group of people in traditional working ages and using real data from Europe, around 30% of those people aren't actually in the workforce. And if you look at people who are above the age of 60, it's actually only a very small proportion who require care and support. So why are we distinguishing between what are now the light blue below and the light blue above the line? And one of the fundamental approaches that the report takes is to pull that line away completely and say we need to think of society as a whole and life as a continuum from the beginning until the end, while the report itself focuses on the second half of life. And if we're going to do this, it demands public health action. Because what is essential for this more optimistic outlook on society is that people can retain their health. So what can we do? Well, the first thing we can do is change the way people think, as the Director General said. And one of those misconceptions which she spoke of is this idea that there is a typical older person, as was reflected in that image with the older person with a cane. In fact, nothing could be further from the truth. Older age, one of the hallmarks of older age is great diversity, even more so than in early life. And so you can have an 80-year-old who's very robust, very active participant in society, and you can have somebody much younger who requires significant care and support. What's also important is that distribution, that diversity is not random. That the person at the top is frankly more likely to be a person like you and me. Someone who's well educated, comes from an advantaged background, has many more life opportunities than the person at the bottom of that range of ability, who's much more likely to have experienced cumulative disadvantages over their life course. And that's absolutely crucial in terms of developing a population response, because policy needs to address the needs of both the top and the bottom, and we need to make sure that the person at the bottom who is likely to have the least resources available to them to deal with their issues is supported in doing that. We also need to make sure that policy just doesn't reinforce those disadvantages that have occurred across that person's life course. Another misconception that the report highlights is the idea that population ageing is going to send us broke. Now, yes, as people get older, they tend to demand more health services. But it's not as strict a relationship as you might imagine, and it varies very much between different systems. So some systems in some countries, the relationship is very high, and the older you get, it becomes very costly. In other systems, the difference is not quite so distinct. And particularly where there's long-term care available. Because what we find in countries where there's long-term care available is that health costs actually start to fall after the age of 70, 75, because there's an alternative. And this ties in with what the Director General was saying. Providing long-term care has benefits for the older person, but it also has broader benefits for society, and in this case, health systems. The other issue about thinking of expenditure on ageing is it's often portrayed as a cost. And if you think of these things as a cost, the emphasis goes on cost reduction and how do we control costs. So here we're talking about health systems, long-term care, education systems for lifelong learning, building age-friendly environments, and other means of social protection like pensions. But what the report says is a much better way of thinking of these expenditures is to think of them as investments. And if you make an investment, you expect a return. And the return for older people is quite obvious. If you invest in health systems, you get health. If you invest in education, you get skills and knowledge. And if you invest in long-term care, people can live lives of meaning and dignity until the very end. But there's also a return for society. And that return is the well-being of the whole population, but also the ability of older people to contribute in the many, many ways that they do, either informally through their family or in the workforce, through consumption, through entrepreneurship. And it may surprise you that the most successful entrepreneurs in the United States are older people. Through innovation. The cover of our report shows the winner of a major art prize in the United Kingdom last year, who happens to be 84. And also, if we provide these services, we can build social cohesion, which I think is absolutely crucial as we move to this SDG era. The final misperception, which is crucial to this report, is there is an idea that, yes, we're living longer, but we're living longer and healthier, and that means everything is possible. I'm sorry, but 70 is not yet the new 60. When we looked at all the information that's available, there is very little evidence to suggest that people are actually living longer. Those extra years are in better health than was the case for their parents or grandparents. So what the report says is 70 is not yet the new 60, but it could be, and it should be. And that's the challenge before us, ladies and gentlemen. So what can we do? We first of all need to shift from an idea that healthy aging is about the absence of disease. For an older person, exactly as the Director General says, what's much more important is the ability to do the things that matter to them. And just as she says, I have high blood pressure, I have another morbidity, and yet I still maintain my functional ability. So what is functional ability? It's got two components. The first is me, as you see me standing here before you, from my skin inwards. And you can see across life, yes, it can deteriorate. There's a general trend, and when we look at the data, there is no one day where you suddenly wake up and you're old. It's just a general trend. And that's dependent on underlying age-related changes, but also if we get diseases and our behaviours and so on. But our ability is not just me. Our ability is me and the environment I live in. If I want to sit down, I need a chair. If I want to get somewhere, I need transport. And so if you think about functional ability, we need to be thinking about what we can do to boost my capacity, me standing here, but also how can we create environments that allow me to do the things that are important. And the good news is that wherever you are in the life course, there are actually things you can do for both of those. So in the early stage when we have high and stable capacity, things like preventing NCDs are absolutely crucial, and breaking down the barriers that prevent participation. If capacity starts to decline, though, we need to be building systems that can actually slow those declines and reduce the subsequent decline into care dependence. And that's a time when things like disabled access public transport and other environmental interventions become particularly important. And in this last phase of life, it's absolutely crucial that people receive the care and support they need so that they can live their last days with dignity. Finally, the report identifies 4 key areas for moving forward to achieve these things. The first is we need to realign our health systems so that they better meet the needs of the populations they now serve. older people in most cases. And this means shifting towards integrated and person-centred care. We also say quite strongly that today there's no country on the planet that can afford not to have some form of long-term care system. Now that doesn't mean in the middle of Africa massive investments in institutions, but it means somebody who can take responsibility for pulling together the caregivers there and seeing what can be done to make their lives as supported as possible. Finally, thirdly, we need to ensure that we all have the opportunity to grow old in an age-friendly environment. And it's a great pleasure to be talking to you today from Washington, which is a member of the WHO Global Network of Age-Friendly Cities. So there are concrete steps which are already in place around the world to move that forward. And finally, we need to rethink how we measure, monitor, and understand these basic concepts like healthy aging and how we might measure them. So thank you. I urge you to read the report, and I hope you find it inspiring.
Thank you, John. Muchas gracias, John.
Thank you very much, John. Let us now ask Attorney Kathy Greenlee, Deputy Assistant for Aging and Administration of the HHSS of the United States. We look forward to hearing you, madam.
Good morning, everyone. John, the longer you talk, the more excited I got, so that was pretty cool. Director General Chan, it's wonderful to do this with you this morning, as well as with Director Etienne, so thank you for being here for this support. I also just want to say to Dr. Beard, to John, welcome to the United States, John. John and I have been working together as colleagues for many years now, have participated in other venues, on-site events. We call each other. I need someone on my panel. But we usually do this in Geneva and in different venues, and this is the first opportunity that we've had to do something, I think, here together in the United States. And he and I have been talking about this report for several years and did not anticipate when we were talking about that I would have the opportunity to support him either further by coming today on the launch of this report. So this is just personally exciting for me to have the opportunity to repay the favor and continue to demonstrate support. It's also an honor to be here on behalf of the United States government, specifically the Department of Health and Human Services. I am in the 7th year of my position as the Assistant Secretary for Aging and have worked for two wonderful secretaries of Health and Human Services, Secretary Kathleen Sebelius and then Secretary Sylvia Burwell-Matthews. Both Secretary Burwell and Secretary Sebelius have been integrally involved, actively involved with the WHO for the past many years, and demonstrated to the rest of us as Assistant Secretaries their value in us supporting the work and also providing international leadership on topics that we work on and love. And so for me to continue to have the support of the secretaries on the topic of aging is just tremendously important. We also work with colleagues in the Office of Global Affairs. First, it was the Assistant Secretary of Global Affairs was Nils Dalliere, and then Jimmy Kolker, who both have been tremendous advocates for aging, have been instructive to me on how best we can provide leadership around the world to talk about these important issues. John, in the slides that you just presented, your first graphic showing the falsity of waking up one day and being old was one of the best visual representations that I've ever seen about what aging really is, and sort of underpins the entire approach to the report. I have worked in the field of aging for most of my career. Every single person that I've ever talked to, regardless of how old they are now, has the same goal for themselves when they were old. And I don't think this is common when you talk about other populations, but really, all of the old people around the world, regardless of where they live, have one common goal: their own independence. It's that basic for all of us. How do we maintain our independence, either for our entire lives or for as long as we can? That independence is the thing, the value as humans that we cherish the most, and that gets stronger, I think, as we get older. It's so important that WHO, in this report on world health and aging, has focused specifically on functional ability. because the functional ability is the health secret to maintaining independence. It's what we need to be looking at and investing in on behalf of an older person's health. And it's the same work, but it's a slightly different lens. At WHO, we spend a lot of time focusing on non-communicable diseases, NCDs. And for an older person, these are exceedingly important discussions, but they have a little twist. It's not the diabetes, it's the amputation of a foot. It's not the hypertension, it's the paralysis that comes from having a heart attack or a stroke. It is the impact of a lifetime of health that most drives functional ability when someone gets older. And so I think this is a wonderful complement and supplement to all of the other framing and all the other health policy work that WHO is doing, and also occurring at a very important time as the world continues to age and the roughs move to catch up with Japan and the other countries that are ahead of us. How do we support someone's ability to maintain their independence and their health for a lifetime? It is the most important investment we can make for each of us and also for the world. And in this regard, the developed countries, the developing countries, the middle-income countries are all facing the similar exact challenge. How do we help the old people in our country maintain their independence? And the differences are the tools at our disposal in our countries, the systems that we have to support that. But the goal is really a universal goal. It's also important, as John was doing his presentation, to talk about the physical environment, and WHO really has been a leader in talking about livable communities. And it's the livable communities, the physical environment, that here in the United States I often worry about as well, and where frankly I find some of the most difficult challenges. That we in the United States have been promoting for many years now public policy that helps people live in their communities as they age. And so I envision all of these old, wonderful people in America living at home where they want to be, with no ability to get around when they lose their functional ability to drive. And so how do we support transportation and housing around the world? Because one of the things that John put on his slide but didn't point out was that social inclusion is a key to well-being and happiness for older people. The ability to maintain contact with their loved ones, their friends, their lives, their social communities. So we cannot overlook the impact of the social environment on health and well-being, and I think this report does a great job in framing both. And I had a chance to look through the report last night. I love the description and the definition of healthy aging, the process of developing and maintaining functional ability that enables well-being for older age. And when we have a chance as policymakers to talk about well-being, we're in the right lane, doing the right work. So I will continue to work with you. I have been working with John and the Center for Aging Alive course, other aspects of WHO for many years. We look forward to consulting on this report. I will show up again in Geneva and come for the agency or the country consultations at the end of October. And John rightly points out, this report rightly points out, that there's not a typical older person. Dr. Chan, we agree with you. There's no one quite like you. Every one of us are different. And I don't sing and dance. It seems like you do a lot of sing and dance. I don't do the same singing and dancing, but we're all unique. That's the beauty of the diversity of the world. We're all unique. But we are also all exactly the same. And that's where the most opportunity is for us, that we all want the same thing. And we don't want to wake up one day being an older person, a different person. We're all a day older than we were yesterday. Age is the human experience that unites every single person in the world. And in that regard, I think this is a hopeful report that gives us a good pathway forward to do good work on behalf of every woman we serve in our countries and around the world. So thank you for allowing me to be here this morning.
Thank you, Kathy. Ahora,
Let us now turn to the director of PAHO, Dr. Carissa Etienne, who will speak to us of the impact, the relevance of this report on aging and health from the standpoint of the Americas. You have the floor, Madam Director. Thank you very much, and a very good morning to all.
Excellencies, distinguished delegates, Dr. Chan, Dr. Kathy Greenlee, friends, colleagues, good morning. Today, global health draws attention to the demographic shift that is overtaking the world and the region of the Americas by storm. Let me thank Dr. Chan, the Director General of WHO, for choosing to launch the World Report on Aging and Health right here in our region. Let me also commend John Baird and his collaborators for putting together this report. As early as 2002, the 26th Pan American Sanitary Conference approved a resolution on health and aging. By approving this resolution, member states highlighted the need for understanding the enormous implications of population aging for many of the health priorities of the Americas. And in 2009, the 49th Directing Council and the 61st session of the Regional Committee, Ministers of Health of the Americas, approved the Plan of Action on the Health of Older Persons, including active and healthy aging. So we've been at it for a while. These efforts were in response to the rapid demographic transition that was occurring in the Americas. In 2006, there were approximately 50 million older persons living in Latin America and the Caribbean, a figure that is expected to double every 25 years to 100 million in 2025 and 200 million in 2050. We will soon be looking like the graph in Japan. Not only are there more older individuals in our region, they are also living longer. Someone who today is 60 years old, DG me too, has a life expectancy of more than 21 years. 81% of the people born in the region today are expected to live past 60 years of age, and 42% are expected to live past the age of 80. In 2025, indeed, there will be many million persons age 80, some 15 million age 80 and up in the Americas. So this trend towards aging really is a result of the social and economic investment and policy development of our member states in this region. And I dare say maybe, perhaps, it's importantly due to the advances that we have been making in the field of public health as well. Important to note, however, is the need for us to be ready to respond to the challenges that this demographic shift will inevitably bring to our societies, our social protection systems, and especially to our health systems. The report brings to our attention the loss of 10 years of healthy living because health and social systems are not ready to provide independent living and long-term care for those who need it. The report also makes clear that for achieving and maintaining a fully functioning life, older adults need not merely to fight against disease, but to live out their full potential in conducive environments. It is intended, this report, to challenge us all to work for healthy aging and the health of older persons. It will help us identify new ways of adapting current health systems to the needs of older persons and to ensure that their needs are met and considered within the whole context of universal access to health and universal health coverage. But of course, the work of WHO and PAHO extends far beyond this report. We need to translate its knowledge into policy and practice. This work will be challenging for the Americas. Every country in this region is aging, and we are aging at a speed that has never been seen before. But they are aging in different moments of economic and social development, among different population sizes, and within different epidemiological contexts where new challenges are intermingled with those unresolved. So today, the Secretariat, PAHO, and I may dare speak on behalf of WHO as well, we commit to support our member states to respond to these challenges, promoting the quest for healthy aging and enhancing the contributions of older persons to social development. Old age is a destination that every one of us aspires to, including, so the decisions and actions that we make now will have an impact on the lives of many individuals and hopefully each of our own life. And so let us therefore work together to ensure that health adds life to years. Thank you. So before Quacktimo comes to say something, I just want to say we thank all of those who participated, but the Directing Council continues immediately after this. Thanks.
Muchas gracias.
Thank you very much, Dr. Etienne. We heartily thank all panelists for their participation in this meeting, and we thank you, ladies and gentlemen, for being present for this important event. The launching of the report is happening virtually as we speak, and that's why we're so pleased that you were with us. Might I suggest that during the coffee break this morning, you go under the tent where coffee is served, which is when the launch will actually take place. The Directing Council will start promptly at 9:30. Thank you.